Hi, before we get started, I wanted to talk about a couple of the references that we'll be using during the presentation. The first part, the bulk of this presentation is from a study by Minakami and Cullum from 2011. It's an older study, but it talks about the benefits and drawbacks of EHR systems. Um, and the second one is a study by Musa from 2013, and this one talks about basically employee satisfaction related to training in the EHR systems, and these two are where we get our information. Thank you so much for listening, and we look forward to talking to you. Hi, my name is Alex,
And I'm Asif.
and we're here to talk about our group assignment about the pros and cons or the factors in change of implementing a new electronic health record system. I'm going to start first, and I chose the side of factors resisting change, and some of the things that would keep a hospital from implementing this kind of a upgrade or change in the system. So first, I said hospital administration, and if I could give this a higher score than 5, I would. This is the financial cost of upgrading the hospital to a new EHR system. And there needs to be an understanding that there's the initial cost of setting it up and the ongoing maintenance cost. And that's not a small fee as far as I understand. There's also the loss of billable services as providers get used to billing differently. Things get lost, and oftentimes billable dollars go down in the initial period after the upgrade. Second, I want to talk about the direct care staff, and I scored this as a 4. And this is the mental time and effort it takes to train and retrain on a new electronic health record system. It's not small, and it's not stress-free for those directly involved in it. Third is the unit manager, and this is kind of a smaller chance, but something to be considered is that there's a possibility that older, more experienced nurses may use this as a catalyst to leave or retire, thus causing nurses shortages and stress on the unit manager's part, and they need to be able to staff their department. Next is the DNS. This was a loss in productivity from the nursing staff as they learn, because they're not going to be as efficient in a new system as they were in the old system, even at least in the short term, depending on the long term where that's going to be headed. And this may lead to some overtime for nurses and an initial spike in mistakes in charting. And then this kind of piggybacks off of this, but this is an impact on the DNS and the unit manager, and that the increase in mistakes is going to need to be corrected by leadership, being the DNS and unit manager, which could lead to an increased work hours and frustration on the part of the leadership team, as well as the nurses. And I scored these both as 3. And we'll tally them up later. Asif, your part?
All right, so I did mine on the factors for change. And first up, we have the hospital DNS, and implementing a unified EHR system would help standardize documentation practices and ensure compliance with like the regulatory requirements and HIPAA and stuff, all that jazz. And it'll reduce potential risks, and it will improve the overall quality of care just by having like a more unified standard charting system, documentation system. And I gave that a 4. I think is pretty important. And next up, we have the unit manager. The new EHR system will help streamline the administrative tasks such as documentation, scheduling, billing, or reduce paperwork and like the manual effort it takes from having actual people doing all this work. You can cut those costs by having a charting system that makes them not useful anymore. And this can free up the time for unit managers to focus on more strategic and patient-centered activities. I gave it a 2. I feel like it's probably not all that important, but it's still pretty good. We have the direct care staff. The new EHR system can improve patient safety by providing accurate and up-to-date information on allergies, medications, and medical history, and minimize the risk of errors or potential adverse effects. And I gave this a 5 because patient safety is #1 priority at all times, always. And if this will help keep patients safe, then it needs a 5. And we have the DNS again. The new EHR system can promote better communication and collaboration among the healthcare teams and enable seamless information exchange, care coordination, and interdisciplinary collaboration. I work in an outpatient clinic as a phlebotomist. I can tell you, contacting other providers and getting information from other pharmacists, it can just be a huge headache. So having a more streamlined way of communicating with other providers and other healthcare team members would be very helpful. So I gave that 3. And then we have the direct care staff. Direct care staff can benefit from more efficient communication among team members, leading to faster transitions of patients, faster changes in patient orders, and better patient outcomes. I gave that a 4 because, once again, patient safety and satisfaction is our #1 priority.
Okay, and so over here we have the general tally of our items, and the total comes out to +1 in favor of implementing the change, which I think is the general trend that healthcare is moving into. Being on the cutting edge of technology and EHR systems seems to be the most common thread, especially among major hospitals that essentially function as IT systems as well as healthcare facilities. And so we wanted to take a moment to talk about what would come next after we've decided to implement this change. And the first thing I would do is talk to IT and the EHR company and get a timeline and an estimated cost of installation, including maintenance. The next thing we would do is talk to the financial office and see if money is available for the system, because it may be wonderful, but we don't know if the hospital can spare that kind of money. The next thing I would do is get a representative from the EHR company out to our facility and see what their training schedule is like, how long it's going to take, what they're going to need, because I want to gauge how much of our staff's training is going to take them away from their work. The next thing to do is establish a complaints department and a user feedback system, because there may be things that this company says are great, but we know that our nurses that are working firsthand with it may find it frustrating and will need to be changed. And we understand that there's some lag in that, but it's important on a number of different levels. And then lastly, we want to establish nurse leaders, and these will be nurses that receive extra training. So this could be unit managers, nurses on the floors, the DNS, and they would be sort of go-to people to both inspire other nurses to use the system well, and also act as like a on-site help department if there are things that they can do without going directly to the IT department. Asif, does that sound okay to you?
Sounds splendid.
All right, awesome. Thank you so much, and we will be implementing this change to our healthcare facility. Thank you.